Hello, and thank you so much for joining an overview CSAT Quality Assurance Review QAR Site Visit Process webinar. At this time, all participants are muted. You may submit questions at any time via the Q&A feature on your screen. Questions will be answered by the SAMHSA CSAT team. If all questions are not answered during today's session, they may be addressed at a later date. Captions are enabled today. You may show or hide captions at the bottom of your screen. Handouts of the presentation will be made available, and today's webinar is being recorded. Today's agenda. We will start with a welcome and introductions, followed by Substance Use Prevention, Treatment and Recovery Services Block Grant, SUPTRS BG Quality Assurance Review, QAR background, changes to the QAR review, statutes and regulations, aspects to the process, key stakeholders, reminders and next steps, and we will conclude with questions and closing comments. This webinar is being conducted by the CSAT Quality Assurance Review team, and it is now my pleasure to turn the call over to Talisha Searcy, Director, Office of Performance Analysis and Management, CSAT. Please go ahead.
Wonderful. Thank you so much, Kayla. I am excited to have the opportunity to welcome you all to today's presentation. The Center for Substance Abuse Treatment has been working diligently to make improvements to our quality assurance review process. The SUPTRS BG program is instrumental in ensuring that there is substance use treatment and prevention activities that are happening across our nation. And you, as our states, are key to ensuring the success of our program and also ensuring that services are to those individuals within our community that are in need. So I am super excited to introduce the team for the Quality Assurance Review within CSAT. They are housed within the Office of Performance Analysis and Management. Next slide, please. The Quality Assurance Review team consists of 3 staff within the Center for Substance Abuse Treatment, and they are instrumental in serving as your liaisons as we are engaging with you with any state as it pertains to the Quality Assurance Review. Erica McCoy, who's a public health advisor within our organization, Neze Nwanko, who is also a public health advisor, as well as Rosemary Payne, who's a senior public health advisor. These staff will reach out to you regularly through the QAR process, work with you regarding scheduling, and also accompany our contract staff on site as we engage in the process that we'll outline during today's webinar. With that, again, I want to welcome you to today's presentation and turn things over to Rosemary Payne, who will walk you through the background of the Quality Assurance Review process. Rosemary, take it away.
Thank you, Talisha. Good afternoon. Thank you for joining us live for the overview of the Quality Assurance Review QAR process, and to those of you who will be listening to this as a pre-recorded webinar. The Substance Use Prevention, Treatment, and Recovery Services Block Grant. Next slide. Block Grant is a formula block grant program that provides funds and technical assistance to U.S. states, territories, and a tribal entity. The grantees use SUPTRS block grant funds to plan, implement, and evaluate activities that prevent and treat substance use and promote public health. Targeted populations under the block grant include pregnant women and women with dependent children. This also includes pregnant persons and persons with dependent children, intravenous drug users, tuberculosis services, early intervention services for HIV/AIDS, and primary prevention services. From a background perspective as it relates to the quality assurance process, the SAMHSA Quality Assurance Review team conducts the quality assurance reviews under Statute 300-55G, Title 42, the Public Health and Welfare Statutes. Therefore, all 50 states, territories, or jurisdictions and 1 tribal entity will participate in a quality assurance review. The SUPTRS block grant statute requires quality assurance reviews each federal fiscal year across SAMHSA centers. SAMHSA is required to conduct at a minimum of 10 quality assurance reviews per federal fiscal year. The quality assurance review also permits SAMHSA CSAT to identify promising practices, challenges, and barriers to SUD treatment and recovery services at the state level. Next, I'm going to provide a broad overview of the quality assurance review process. Later in the presentation, Erica McCoy will provide additional details about the quality assurance process. Next slide. During the quality assurance review, there are three main areas of focus: administration, clinical, and data. The quality assurance review consists of three phases: a pre-site phase, on-site phase, and a post-site phase. During each of these three phases, there are specific activities that occur. One is the desk audit. Two is the on-site or virtual review. That includes client interviews and a facility tour. And three, the quality assurance concludes with a final summary report, in addition to recommendations and/or corrective action plan and state TA recommendations to be addressed by the single state agency. Next, I'm going to discuss the key areas of focus of the quality assurance review. Next slide. The focus of the quality assurance review is specific to the SSA's conveyance and monitoring of the SUPTRS block grant requirements. Again, there are three main focus areas: administrative, data collection and monitoring, and clinical. The list under each one of these focus areas is not exhaustive. For example, under administrative, as a requirement, the SSAs are required to maintain, develop and review and update as needed policies and procedures on an annual update. For example, we are looking for evidence that the SSA has policies and procedures related to the conveyance and monitoring of the independent peer review process, and evidence that the IPRs are actually being conducted. Under data, wait list and capacity management system, for example, during the quality assurance review, the SSA will be required to provide a demonstration of the agency's wait list management program according to Federal Statute 45 CFR 126C. Lastly, clinical, looking at SUDS treatment, medical records documentation, evidence-based practices and fidelity, licensing and onboarding, education, and annual training. For those of you that have been in this space for years, you are aware many of the block grant statutes and regulations have not changed much. However, the dynamics of the population served under the block grant continue to evolve, new challenges arise, federal and state funding streams change, so everyone is required to remain abreast of these changes and how these changes relate to the SUPTRS block grant requirements and the population served. Another example are the recent updates to the SAMHSA criteria for level of care assessment or specialized training for peer support specialists and addiction counselors who may have initially began their career supporting persons living with mental health disorders, or individuals who are now working with the SUD population or justice-involved populations. Many of these populations have similarities, but they have a great deal of differences in needs and the motivation for seeking treatment and services. Lastly, the rise of polysubstance use, inclusive of fentanyl and xylazine, also present new challenges. Under the new QAR structure, there have been several changes from the historical compliance technical reviews. Next slide. Prior to federal fiscal year 2021, the quality assurance review were known as compliance technical reviews. Based on the current process, your quality assurance review will not include prevention, mental health, or the Office of Financial Advisory Services, or OFAS. The other two centers and OFAS will conduct their own quality assurance review. Therefore, during the CSAT quality assurance review, there will not be a fiscal audit. However, during the quality assurance review, there will be a discussion regarding the number of persons served and the services provided under the block grant, separate from the persons served under other federal, state, or local funding like Medicaid. In the past, these single state agencies were able to select the intermediaries and subrecipients who participated in the compliance technical reviews. Under the new process, the CSAT Quality Assurance Review Team makes the selections of the intermediaries and subrecipients and notifies the SSA in advance of the on-site quality assurance review. The number of intermediaries and subrecipients will depend on the size of the state, territory, or tribe. Also under this quality assurance process, following the completion of the quality assurance review, the quality assurance review team may make recommendations that support the need for a corrective action plan and state TA to support the SSA in addressing the corrective action plan. The quality assurance review will conduct an annual follow-up on the corrective action plan to ensure the action is either in progress or nearing completion. The CSAT State Project Officer will direct oversight of the corrective action plan and the technical assistance and will work with the SSA and the TA contractor who is currently JBS International. Lastly, we have had the fortune to have the Brazil US, who is our current contractor for the quality assurance reviews to support our quality assurance review efforts. And you will have the ability to be introduced to that team as we conduct future quality assurance reviews. Next, I'm going to cover how the SSAs are selected for the quality review. Next slide. We select the SSAs based on 6 major criteria. The first is the date in which the SSA had their last QAR, or in the past, the compliance technical review. We also review the block grant expenditures during a specific review period, and that will be communicated to you as the SSA when you are notified of your quality assurance review. We also look at the number of admissions and persons served based on your web BGAS reports. We look at treatment utilization data. We also look at MAT, or medication assistance treatment for alcohol use disorder, or MOUD for opioid use disorder utilization, noting the number of providers that you may have within your state and any challenges that individuals may have in seeking MAUD or MOUD treatment within the state. In preparation for the quality assurance review, we do our due diligence to ensure we have a strong understanding of the SSA's organizational structure and the system of care by reviewing and analyzing information and data that is submitted to CSAT via web BGAS prior to the initiation of the quality assurance notification to the SSA. Next slide. In preparation for the quality assurance review and during the quality assurance review, the team refers to multiple aspects of the SSA SUPTRS block grant plan and report for the quality review period. Each of these sections in the plan and the report should be familiar with you. In the plan, capacity of the state to treat SUD and provide recovery support services is very important. In the plan, we consider the SSA's response to unmet needs and critical gaps. We also analyze the expenditures on tables 2, 4, 6, and 8B in alignment with table 10, treatment utilization, as well as your TEDS data. As I previously mentioned, the quality assurance review team will select the intermediaries or subrecipients who will participate in the quality assurance review. The intermediaries and the subrecipients will be selected from Web BGAS Table 7, the statewide entity, based on funding allotments. The selections are confirmed with the SSA based on whether the intermediary or the subrecipients were funded during the period of review, and that same intermediary or subrecipient is currently receiving block grant funds. As a reference, we have provided the 12 SUPTRS block grant federal statutes and regulations that align with the QAR. Next slide. We have a saying here at SAMHSA that when you engage one state, jurisdiction, or tribal entity about the block grant, you have engaged one. They are all different. However, I like to say they may be different. However, they all submit a SUPTRS block grant application, and in the application attest to comply with the 12 SUPTRS block grant statutory and regulatory requirements. During the process, the quality assurance review includes a reviewing of a lot of information that comes from WebBGAS, as well as information that is submitted through the SSA and the intermediary and subrecipients. We also, part of this process includes a great deal of discussion. We analyze the data and the information provided. We conduct client discussion groups or interviews, and we also make a lot of observations during our tours. And using this process, we are then able to determine whether the SSA is fully in compliance with the 12 statutes and regulations related to the SUPTRS block grant, whether they are in partial compliance with the requirements, or if they're in complete non-compliance with the SUPTRS block grant requirements. I want to leave with several key takeaways from this presentation. For the SSA, again, the QAR determines how the SSA conveys and monitors the administrative, data, and clinical aspects of the block grant, according to the 12 SUPTRS block grant statutes and regulations. For intermediaries and subrecipients, the QAR determines how the intermediaries, subrecipients implement the administrative, data, and clinical aspects of the block grant. Occasionally, a state or jurisdiction may have an intermediary with the dual role of oversight and service delivery. Therefore, the quality assurance review determines how the intermediary implements the requirements, as well as how the intermediary serves as a direct service provider under the block grant. Therefore, again, all single state agencies, jurisdictions, and the tribal entity are required to convey and monitor all 12 of the block grant requirements to all subawardees who receive a block grant fund. And all subawardees are required to implement the applicable SUPTRS block grant requirements, with the exclusion of the federal opioid treatment standards if they apply. To end this section of the presentation, I look forward to meeting and collaborating with each of you in the future. At this time, my esteemed colleague, Erica McCoy, will discuss the QA process and other pertinent information in greater detail. Thank you again, and I look forward to working with you. Erica?
Good afternoon. Thank you, Rosemary. My name is Erica McCoy. I'm a public health advisor in CSAT's Office of Performance Analysis and Management. And I'm going to be going over the QAR phases and key stakeholders. Next slide. So to get us started, there really are three key aspects or phases to the QAR. And so I'll be going over each phase in depth throughout the next few slides. So first we have our pre-site, and that really is getting us started and laying a foundation prior to our on-site visit. So once we do our pre-site activities, we will be on site in the state. And then once we're on site, we'll be on site for about 1 week visiting with the selected providers or subrecipients. And then once we come back, we will have a final report, which really is that third and final phase of the QAR process. Next slide. So really, once we are starting to gear up the process, states are identified using their criteria that Rosemary reviewed a few slides ago. And so one of the QAR team members, so myself, Neze, or Rosemary, will be identified as your point of contact. And so your point of contact is really available to answer any questions or concerns that you as the SSA you have throughout the process. And we also make ourselves available even after we conclude the QAR process. So once we have our states narrowed down, we've identified which states we like to visit. We do meet with your regional director and your state project officer for CSAT under the block grant to discuss any relevant organizational, clinical, or program innovations and hindrances that may be going on within the state or the region. And so once we have our internal conversations, we will send out an email notification to the SSA and the SUPTRS BG coordinator. And that email really notifies them you've been selected, and it will also include a few dates for us to have a series of meetings. And so part of the point of contact's role is really to confirm some of those subsequent meetings that I just mentioned. And then, as Rosemary mentioned, we will select a number of subrecipients or direct service providers based on your Web BGAS Table 7. And so those, once confirmed, those selected subrecipients will have a series of meetings as well. Next slide, please. And so really looking at the series of meetings that I just mentioned, the first meeting that we will have, it'll be sort of a kickoff meeting with key SSA staff and staff from SAMHSA. So it will include the QAR team from SAMHSA. It will also include our contractors that have been mentioned. And it will also include your regional director and your SPO. So during that meeting, we'll discuss the logistics of the QAR site visit, the scope and expectations. And so we have that meeting with the SSA, but then we'll also have a very similar meeting with the selected subrecipients once they've been identified and confirmed. In those meetings with the selected subrecipients, please know SSA staff are not expected to participate in those meetings with the selected subrecipient. So it really will be QAR staff and the subrecipient staff. Another key element to a successful QAR is the document request. And so that pre-site document request, it really is a important step in sort of level setting for our team so that we are able to have rich discussions related to those three key areas that Rosemary mentioned earlier. So again, administration, data management, and the clinical aspect. And so we will send that list of documents via email as well. Next slide. And so one of the new elements that we have for the QAR process is a SSA presentation. And so this presentation is given by the SSA to SAMHSA staff. And so that really includes the Center for Substance Abuse Treatment Office of Director, division directors, and staff from other discretionary grant programs. And so the presentation will be about 40 minutes of presentation by the SSA, and then there'll be about 10 minutes of welcome and introductions from your identified QAR point of contact. And then we'll have about 10 minutes for Q&A at the conclusion. We do encourage SSAs to have some sort of visual aid, whether it is a PowerPoint presentation or some other aid to help depict or convey the information that will be shared. Some of the topics that are required for this presentation is the state's SUD system of care, any 1115 Medicaid demonstration waivers, whether they have already been approved or they're pending approval, really looking at recovery, harm reduction, any challenge or barriers. Those are really some of the key areas we would like to look at during that presentation. In terms of optional topics, we do have states that want to present on their state opioid response program or how they are planning to use their opioid settlement funds. So all of those are optional topics to include. But again, we're really looking to keep that presentation to about 40 minutes. And so with the required topics, that is a lot of information to share within 40 minutes. So if you are able to include some of the optional topics, that would be great. Next slide, please. So all of that is really done prior to us being on site with the selected subrecipients. So now once we have our meetings with you all to confirm dates and make sure we have all of our documents and we're able to review those documents, then we'll move into sort of the on-site or the virtual aspect. And so with this within phase 2, there are really 4 key activities. And so the first activity is a virtual discussion with SSA leadership, staff, and stakeholders, again, around those 3 programmatic areas of focus: administrative, clinical, and data. And so this is essentially the meat of our QAR. So we will have a virtual meeting again with SSA staff. And so we'll have a brief entry conference where we will review the schedule for the QAR, just confirm all of the selected subrecipients are confirmed and ready to move forward. And then during this meeting, your regional director and your SPO are also invited. And so once we conclude our entry conference, we will invite the SPO and regional director and other SAMHSA leadership to disconnect from the call. And then we'll move into our discussion to where it is SSA leadership and the QAR staff, QAR team staff, and our contractor support. So it'll be that group for the virtual discussion. And that will be anywhere from about 2.5 to 3 hours. We understand it is a long time to be on camera, but it is definitely a beneficial and worthwhile activity. Excuse me. And so once we have the virtual discussion with the SSA, the following week, we will be on site. And so we'll be with the selected subrecipients, and we'll follow a very similar process. We will have a brief entry conference where we review sort of the aspect and what we are looking for during the day together. And then we will move into the discussion area of those 3 areas again: administrative, data, and clinical. Now, I do want to add, while we will be on site with the subrecipients, we don't expect SSA staff to participate in those meetings. That will really be an intimate conversation between the QAR team and the subrecipient staff. And so while we're on site, Rosemary mentioned this briefly, we will have, again, the same conversation and discussion around administrative, clinical, and data, but we will also have client focus groups and conduct a facility tour for direct service providers. So where there is direct service being provided, we'll have a small intimate focus group with about 5 clients, and then we'll also do a facility tour. And if there's any MAT being administered on site, we will observe a med pass or have a demonstration of a med pass. And so while we're on site, we will be identifying any common themes. If there are any concerns across those core functional areas, we'll start gathering that information as well. And we'll also be brainstorming any sort of preliminary analysis of what we've seen, what we've heard. And when we can come back from our on-site visit, we have a formal exit conference with the SSA to discuss any of those. And I'll get into the formal exit conference a little bit later. Next slide. So once we conclude our time on site within the state and we return back to home base, we'll have internal conversations to determine if a preliminary exit conference with the SSA is necessary. And so what a preliminary exit conference is, it's really an opportunity for our team to ask for additional documentation, ask any clarifying questions, just to make sure that when we begin the report writing process, we're able to have a full, well-rounded picture of what we saw and observed while within the state. And so again, that is the preliminary exit is a as needed activity. Every state won't have one, some may and some may not. But the one key activity that every site will have is a formal exit conference. And so the formal exit conference is really a review and discussion of the QAR findings, observations, any recommendations, including recommendations for TA. And we're sharing that with the SSA. Some attendees for the formal exit conference will be our staff, our leadership, the SPO and the SPO leadership from the Division of State and Community Systems, the State Systems Partnership Branch leadership, again, your regional director, and of course your SPO. They will all be invited to attend that. The one thing I do want to add about the formal exit conference is that it really is with the SSA staff. So those participating subrecipients that we did go visit while we were on site, they will not be invited to or expected to participate in the formal exit conference. Next slide. So once we have our formal exit conference, we will be putting together a quality assurance review or QAR final report. And so some of the real key aspects of this report is really looking at SSA findings related to compliance with SUPTRS block grant statutes and regulations. And so from the SSA perspective, we're really looking at the conveyance and monitoring of those statutes and regulations. And from the selected subrecipient perspective, looking at how those providers are implementing those statutes and regulatory requirements that are mandated under the block grant. It will also include a description of the SSA treatment system of care, and then also the subrecipient's clinical service delivery. It'll also include information and descriptions about data collection management systems, and then it'll also include general recommendations for the state, but also any recommendations that we have related to state TA for the SSA. Lastly, it will also include comments and responses from the SSA related to the QAR report. And so we will get into a little bit more information about that in the next few slides, but there will be an opportunity for you as the SSA to review the report and provide any technical edits. And so any of those edits will be included as an appendix to the report. Next slide, please. And so for the report, once it is drafted, the SSA will have about 10 business days to review and provide technical edits, as I previously stated, and those comments and responses will be included as an appendix to the final report. And so one thing I do also want to mention about the report, it is a report that belongs to the SSA. So we will not share the report with any of the participating subrecipients. However, if the SSA would like to share it with them, they have that ability to share it with them. I will also add, we do encourage those participating subrecipients to contact the SSA if they're interested in receiving a copy of that report. And so when we have our kickoff meeting that I mentioned earlier, we'll also share that information as well, that we won't be able to share the report with the participating subrecipients. However, if you would like to, you are more than in your right to share that with them. The report, once finalized, it will not be posted publicly. We will retain a copy for our records, and we'll share that with you, and you'll retain a copy as well, but you are more than welcome to share your report with whomever you would like. So after the report is finalized, the final version will be sent to the SSA. And in the event that there is a corrective action plan or an in-depth state TA plan, we'll have conversations related to both of those actions once the final report is communicated or transferred to the SSA. And then, as Rosemary mentioned before, one of the key changes to the QAR process is really conducting an annual follow-up with the SSA. Like I mentioned, once we complete our QAR process, we are still available for any questions that may arise throughout the implementation of any TA, or if you have any questions, we make ourselves available for any states to be able to help address any questions or concerns. And I did mention the need for, there may be a need for a corrective action plan. So next slide, please. So really looking at the corrective action, again, in the event it is deemed necessary, our team will send the SSA a template for completion. And this is really a role where your SPO will definitely assist in developing any corrective action plan as needed and really addressing recommendations, within the corrective action plan based on the report. And so if, again, it's identified that a state does need a corrective action plan, we'll send our template, and you all will have about 180 days from the time the report is finalized and transmitted to you all to finalize and submit any corrective action plans to our team. And again, we will be following up ourselves, or some of our contractor support will follow up annually just to ensure that the corrective action plan is being followed through. And if there are any questions or a need for TA, connecting you all to the right resources to ensure those are getting completed. Next slide, please. And so now I really want to talk about some of the key players or the key stakeholders. It is truly a group effort in terms of ensuring a successful QAR. So just to get us started, we have the QAR team, and it really is comprised of the three of us. So again, myself, Rosemary, and Neze. One of us will be your point of contact for any questions, concerns. And then we will also have the support of about 2 to 3 contractors. And all of us together are knowledgeable as it relates to SUPTRS BG statutes, regulations, application, reporting requirements. So if you have any questions, feel free to reach out to your point of contact. And if there are any other needs that you may have, feel free to reach out to your point of contact as well. We are a resource, and if we do not have an answer for your particular question, we'll definitely work with our colleagues to get you an answer. So the next key player is your state project officer. So your regional director and your SPO, they both play a critical role in really serving as a consultant during the QAR. And that really is having internal conversations so that we're able to have a fruitful conversation, but also participating in kickoff meetings, the entry conference, and in the formal exit conference. So we really are working with your day-to-day managers and some of the regional directors to ensure that it is a well-rounded group that is there to support you. In the SPO, they also support you as the SSA with any state TA, whether it is the state TA plan or any corrective action plans, but really serving as a support. Next slide. And so lastly, the key players, it really is you all and your selected subrecipients. And that really is active participation. And that looks like providing the required documents for the desk audit for the SSA. And when we reach out and get in contact with selected subrecipients, they will also have their own set of documents that are required. And so again, providing those documents really helps set a great foundation for our conversations with the SSA and with the selected subrecipient. So those are a critical element, and they really help play a key part in having a successful visit. Another way that the SSA is a key player. Once we've identified the selected subrecipients, we will ask that the point of contact from the SSA reach out and notify the selected subrecipients that they have been selected, and really conduct a warm handoff from our team to theirs so that we're able to facilitate again the desk audit materials and any sort of logistics for the day of, so that we know exactly where we're going, and we're able to contact the subrecipients as needed throughout the visit. Another piece that I mentioned is the SSA SUD system of care presentation. And that again is only for the SSA, presented to SAMHSA staff. That really does help, again, help paint a picture of what is going on in the state. Another key activity mentioned earlier is that virtual QAR discussion, the review of systems, the delivery of services for the SSA. But then once we're on site, really looking at the review of systems, the delivery of services for those selected subrecipients. And thank you. I will now turn it back over to Kayla to facilitate our Q&A.
Thank you. And as we transition into our Q&A segment, please submit any questions you may have within the Q&A feature on your screen. We have been compiling any questions that are submitted throughout this presentation, and any questions that are not answered will be answered at a later date. If you do need to exit early, please access the feedback form located in chat now. I believe some of those questions were already answered, but again, if you do have any questions, please go ahead and put those into that question and answer feature on your screen, and we will pause for just a moment for those questions to queue. And we do have a question. For states selected for an upcoming QAR, when should states be expected to receive notification?
That is a great question. I will turn it over to Rosemary.
Thank you, Erica. You can anticipate that you will receive a notification and you will have at a minimum of 30 days before we actually conduct the on-site visit. We will give you ample time to be able to retrieve those documents for the desk audit that Erica mentioned during her segment of the presentation. And we will coordinate based on your schedule, your availability. So we will send you a notification with our preferred date to actually conduct the quality assurance review. And we do understand that there are other obligations that you may need to tend to, and that week that we are recommending is not conducive for you. So we are somewhat flexible to be able to accommodate your schedule. But you can anticipate at least a 30-day pre-notice of our actual physical presence within your state. Thank you for the question.
Great. And our next question, is SAMHSA able to provide the report from the most recently completed QAR? As a state with lots of turnover, there are few, if any, that may have been involved.
I can take that question, Rosemary and Talisha, and feel free to add anything. Yes, we are able to provide the most recent completed report for an SSA. We understand that, you know, staff turnover is a reality, and so we are able to provide that. Talisha, Rosemary, I don't know if you want to add anything.
Sure. There are unfortunately some instances where a review happened a number of years ago. And for one reason or another, we may not be able to have access to that information, but we have gone through as many documents as we can to call all of the prior reports that we're aware of. So when we engage with the state and there are prior reports that we are aware of and we have those documentations, we will provide the state with the prior report to provide to the state, as well as any other information that's requested just in terms of preparation that states have in terms of their QAR review.
Thank you. And our next question is, who at the SSA will be notified by email? Is it taken from the application?
This is Rosemary. Great question. Yes, we do take the information for the SSA and the block grant coordinator from the application. So it's really important that you work with your state project officer to make sure that The information registered in WebBGAS is current and up to date. We have had a couple of occasions where the SSA as well as the Black Grant Coordinator changed. And so we were sending emails to people that either had moved within the organization or were no longer affiliated with the organization. So yes, we rely on the Black Grant application and the information that is in WebBGAS. Thank you for your question.
Wonderful. And we have a few more questions here. When will we find out if we were selected for a QAR?
So at this time, everyone for the federal fiscal year 24 has been notified of their quality assurance review. We are starting to gather information for federal fiscal year 2025. So stay on the alert from an email from SAMHSA CSAT, because you may be next on the list to have a quality assurance review with us next federal fiscal year. Thank you for the question.
And how often do states receive a QAR?
Sure. So one of the things that we are trying to do at SAMHSA is balance. So as was mentioned today, we're required to do 10 reviews across all of our centers. And so for CSAT, our target is 5 QARs per year. So you can kind of do the math. It means that states may be hit up maybe once every few years. We try to make sure, and as was explained today in terms of the criteria, that we try to spread it out a little bit and focus on when the last quality assurance review was held as part of the criteria that we use for determining who is up next. So it's not something that happens annually. It is something that happens with a few years in between, but it is contingent on when your last review was held. I hope that answers the question.
Thank you. And our next question is, if our state completed a QAR last year but did not receive a QAR report, how can they get a copy of that? And do they need to request it from their GPO, or is there a better contact?
Yes, so we recognize that there are a number of QARs that were held and the reports are still under development. So for those states that had a QAR and the reports are still in draft, we are working to finalize those reports. Please feel free to reach out to your respective QAR liaison, and they can provide you with an individual update regarding the status of your report. Also, just as a reminder, for those QAR reports that have not gone to you yet, just as a reminder, we allow states to provide us with feedback regarding the QAR and a response to any recommendations that were made. So that process will still hold true. Again, we apologize for the delay with the reports. We've added on contractor support, and there's just been a number of things that we're trying to do that are new. And so we're happy to reach out to you. Feel free to reach out to anyone on the team, and we can provide you with an update regarding the status of your report.
Wonderful. And as a reminder, if you have any questions at all, please feel free to insert those into the Q&A feature on your screen. And our next question is, are these QAR reviews coordinated with CSAP? For example, our state has a CSAP site visit scheduled for this coming September, and is it possible we might also be in line for a QAR?
Sure. So we across SAMHSA work diligently. So as was mentioned today, each center has their own review process. So you have CMHS, CSAP, as well as CSAT and OFAS. What we do is we try to coordinate internally to ensure that we're not hitting up the same states with multiple reviews from different centers at around the same time. So we coordinate with CSAP to ensure that we're not duplicating efforts when it comes to which state receives a review. So if you have been tapped for this year to do a CSAP review, then what we try to do is make sure that you wouldn't have a CSAT review this year.
Thank you. And they also said thank you. And our next question is for states selected for an upcoming QAR, when should states be expected to receive notification?
As I mentioned, this is Rosemary. As I mentioned earlier, if you are selected for a quality assurance review in the future, you will be notified at a minimum of 30 days in advance of the time that we would like to schedule the quality assurance review. So there's a lot of effort that goes into the selection process, the notification process, and again, trying to be as flexible as possible with meeting the SSA and the intermediary or subrecipients in a fashion that's going to be conducive to your schedule for that fiscal year.
Thank you so much. And our next question is, has there been any thought given to consolidating the CSAP and CSAT reviews to doing them together other than spreading them apart over different years?
Alicia, I'm going to let you respond to that question.
Yes, no, I'm happy to answer that question. That is something that had been contemplated in the past. But the ultimate decision from SAMHSA was to have them separate, in large part because the statutory requirements on the substance use treatment side are different from the prevention side. And prevention also has to be mindful of SINAR requirements. So while we recognize that it's easier, it may be easier for the states to kind of have all of your experts in the room at the same time to kind of handle your compliance review requirements. For us on the SAMHSA side, it's a little easier for us to break things up to allow for contractor support as well as staff to be our staff to be able to adequately cover the topics that we're focusing on at the time. So, but again, as I stressed before, our goal with all of these is to not be a gotcha situation. We try our best to make sure that, you know, the focus is on program integrity and program improvement and what we can do to not only learn from you in terms of best practices, but provide you with access to the technical assistance that you may need to meet programmatic requirements. But we don't want this to be an overly burdensome process. And so because of that, we really do try to work collectively across the centers within SAMHSA to make sure that we're not hitting the same states at the same time or within close proximity to one another. If that happens, we try our best to avoid that because we recognize that doing these reviews can be taxing for staff, for state staff. Rosemary, I think you're on mute.
Okay, thank you. One other thing that I did want to mention is that we do follow the federal fiscal year. So our federal fiscal year will start in October 1, and that's going to be crossing over between the many of the state fiscal years in which we're going to be conducting the reviews. So as I mentioned, we have already notified the states that are going to participate in the federal fiscal year 2024 quality assurance reviews, and prior to October, we will be notifying future states that will participate in federal fiscal year 25. Thank you.
Great. And our next question is, respectfully, if we are given just 30 days, that does not allow the state much time to prepare.
Again, as I mentioned, it'll be a minimum of 30 days whatever time frame that you are notified, we will give you adequate time to pull the documents that you will need to submit for the desk audit. At a minimum, you will have 30 days to submit the documents that are required for the quality assurance review, as well as the time frame in which we will be conducting the site visit. We're trying our best to increase that, but at a minimum, you'll have at least 30 days or longer before you're required to provide, to collect all of the data and the information that's required for the desk audit prior to our actual arrival on site.
And Rosemary, if I could just add one more point to that, like you were saying, yes, we are giving the 30-day notice at a minimum. But in the event there are any, hindrances or barriers to getting us the full document, um, the list of documents that we request, we are flexible in terms of, if we need to establish some sort of phased approach to getting all of the documents, we are flexible in that. So if you aren't able to get us all documents in one sort of go, if we need to establish an arrangement to where we are getting, maybe half the documents at one point in time, and then allowing for other documents, sort of a batch of upload, we are able to accommodate that as well.
Thank you. And our next question is how many federal fiscal years will be reviewed during the QAR?
Rosemary, again, we will be reviewing one period of performance or one compliance year per quality assurance review. One added tip, we mentioned that our area of focus is around the administrative, the data, and the clinical. So the more that you have good management of your policies and procedures, how you actually convey and monitor the 12 statutory and regulatory requirements around the block grant, is much as possible as keeping that information current, then that should alleviate, a great deal of stress of trying to gather that information in preparation to respond to the notification of the quality assurance review and to provide the documents that are needed for the desk audit. So that's just a little bit of a tip. We've identified the three major areas that we're going to focus on, and looking at the policies and the procedures related to that, the management of your contracts, are some of the additional documents that we request. And so again, we are flexible and try to be as supportive as possible. And as Erica mentioned, it's just notifying us. We don't have this specific document, but could you give us, 24 to 48 hours additional to retrieve that, to submit that information to you. I hope that answers your question. Thank you.
Thank you. And again, if you do have any further questions, please feel free to submit those within the question and answer feature on your screen. And we'll pause for just one more moment to see if any other questions queue. And seeing no further questions, I will turn it back to our presenters for any closing remarks.
Great. Well, thank you all again for participating today. We are committed to not only making this process and improving this process, but answering any questions and really serving as a resource to our states that are implementing our SUPTRS BG program. I encourage you to reach out to us if you have any questions about your current QAR or the possibilities of a future QAR for you and your state. We're happy to support you as it pertains to these reviews, but also any technical assistance that may be fruitful as you are going through the QAR process. So again, thank you very much for participating in today's webinar, and we look forward to continuing to engage with you through the QAR process.
And as a reminder, we are placing the feedback form link within the chat now. Please feel free to click that link to access the feedback form. And states can submit any follow-up questions regarding the QAR process by emailing our QAR team via the email address that we are placing in the chat. Again, if you have any questions at all for the QAR team, please feel free to email the team via the email that's been placed in the chat. And that does conclude our presentation today. You may now disconnect.